People always ask how I became a nurse in Canada after training in the UK, so let's talk about it. I trained and worked as a registered nurse in the UK. Basically, my background is I started nursing in 2009 at the University of Hertfordshire, and I did adult nursing. In UK, you have mental health nursing, learning disability, child nursing, and adult nursing. I went for adult nursing, and once I qualified in 2012, I started working at West Hertfordshire Hospital Trust, Watford. I started in the gynae unit for 18 months, and then I moved to emergency nursing, and that was where I was for 7 years before I started my conversion license. So when I first started, it felt all confusing because I didn't know anybody that had gone through it before. I had nobody to guide me or support me or even give me tips, right? That like the NNAs, the registration, selecting of the province, it was so confusing. I can say is one step at a time. The first thing you need to do is NNAs, obviously. Thankfully, I made it through. My first job here, like I said in my previous post, wasn't in the hospital as a bedside nurse. It was a community health nurse. I worked as a home health liaison. I was working at a hospital, but I was not bedside. I was basically supporting discharges, assessing them for those that need care in the community and ongoing support, which I actually love. I love community health nursing. Fast forward to now, I am a clinical nurse educator. One thing I forgot to mention was that when I was in the UK, I started as a registered nurse, staff nurse. We call it staff nurse then. And then I got promoted to band 6, which is equivalent of a PCC here in Canada, after like 18 months of working in Emerge. So that's, here I am. So if I can do it, you can too. So my job as a clinical nurse educator, I'll do a separate post on that, is basically helping support other nurses in their education. But I'll do a different post on that. If you're an internationally educated nurse dreaming about Canada, don't give up. It takes time, but one step at a time. If I can do it, you can too. So let's do this together. I'll share tips, ask me questions, and I'll respond as much as I can. I'm just a girl who's trying to support my fellow nurses who's dreaming of working in Canada. Follow for more nurse to nurse tips. I've got you. I got you. Bye.